But I wanted to dive into another topic that you talked about, which is very important globally, but especially here, the community you came to speak in here in Spokane, Washington. We have an initiative coming up here that's going to be voted on to fluoridate the water. And Spokane has been very resistant to that over all these decades. And you have special expertise in that area as well as a chemist. Your doctorate in chemistry and your vast, long experience in the chemistry field, both in industry and in academia. So, in a brief nutshell, what are the concerns about putting fluoride into our water?
Fluoride naturally exists in the soil. When we dig out the water from underground water, the fluoride can go into the water, regardless of the very advanced filtration, like a reverse osmosis, cannot extract or cannot remove fluoride.
So even reverse osmosis does not take fluoride out.
That's a very advanced technique for clarification of the water. And to my thinking, the presence of fluoride in natural right now is enough for us to keep the tooth decay and on the shelf existing in the water.
So fluoride appears naturally all over the earth in soil at various concentrations depending on where you are. Some places it's super high and others it's lower, but even in the lower places it's sufficient.
Regardless of you recommend adding fluoride into the drinking water or not, fluoride already existing in your water, your drinking water. And let's talk about toothpaste. In toothpaste, FDA recommend to add less than 1 milligram per kilo of toothpaste to keep the gum healthy.
Toothpaste.
Yes, toothpaste, to keep the gum healthy and to keep the teeth decays.
Now, but say that again, 1 milligram per kilogram.
Per kilo.
It's 2.2 pounds.
Toothpaste, yes. If we add more fluoride, the reverse thing for fluoride, it will make the gum disease, make tooth decay, and more illness according to scientific research.
So the scientific research, as far as I recall, has been ongoing now for many decades.
Yes.
And what are some of the problems that it can cause to our bodies in concentrations that are being put into our water supplies?
I would say, especially for the kid, after 12, under 6, it's very sensitive for fluoride. For us, for the adult people, when we absorb fluoride, 50% already get out by urine.
So we eliminate it mostly through urination.
Yes, but for the kid, young kid, younger than 6 years old, most of the fluoride is already stuck in their body.
And that affects the brain?
The brain, some type of the new thyroid, and kidneys, some type of cancer, liver. That's the reason. I don't know why the city of Spokane decided to add fluoride into the drinking water, and they are going to vote for the coming November for this year.
So
that's my point.
Yeah. Now, scientists around the world, in many other countries, have been successful in helping pass policies so that they're not using this. So what are some of the countries that do not fluoridate the water?
A lot of countries do not, except 2 countries, especially North Island and Singapore.
Singapore and Northern Ireland.
Yeah. They decide, they force it to put fluoride into drinking water. For the rest of the world, 5% of the rest just recommend to add the fluoride, but the concentration should be less than 2.
So here in the United States, that is usually a decision that is made by local municipalities, counties, maybe states at some places, but we don't have a national policy, although
we don't have a...
There's national promotion of it.
Even the cities, the local one, state don't have any order or any restriction on the city. That's the reason we're supposed to have election for the next November.
So, go ahead.
My point is, why? I ask myself, why is this? Someone decide to add this into drinking water, regardless of the scientific result solving the danger of the presence of fluoride in drinking water. I don't know why. I see one point, that's business one.
Say that again.
Business one. Business reason. The reason is, by adding fluoride into drinking water from the system we got right now, so we have to provide the tool how to add it into and control the concentration and provide fluoride to the system. So that means we have to spend more extra money for doing this, and the cost of maintenance, the cost of fee, etc. And we are again a pro fluoridation in the drinking water. But the point is that the business purpose is make some people from the cities, some officials prepare for this law.
Well, so there are several issues involved here. One is, and speaking as a scientist, as a chemist, you've been studying this for many years. One is the scientific argument and the medical argument, the dental argument. Many of the dentists and the dental associations, the lobbies, say, well, this is necessary to protect the dental health of our population. Others, experts like yourself and many others, say no, that's wrong. We shouldn't be putting it. There's the cost risk benefit is too high. But that is just that is an important issue. We don't want to be putting things into our bodies that are going to be unhealthful. But the real issue, it seems to me, is one of medical choice. Do we have the freedom as individuals to decide what goes into our bodies, or is the government, the state, or the local government going to mandate to that? That is mass therapy, mass medical therapy. And so it's a very dangerous thing for the government to come in between the individual and his health provider and to take that over. And is it not quite simple and inexpensive for those people who want to have fluoride to get it without forcing everybody else to get it? For instance, if somebody wants to have fluoride because they think, well, my dentist said it's important that I have it, they can get it very easily, correct?
I can tell you one very typical of the effect of fluoride in Vietnam. In Vietnam, in Nha Trang. Nha Trang is the central of Vietnam. One small district north of Nha Trang called Ninh Hòa. Naturally speaking, in the soil it exists fluoride about 10 milligram per kilo of soil naturally.
So
And
that would be 10 milligrams?
yes, 10 milligram per kilo.
So that'd be about 20 times or?
No, yes, 20 times.
20 times. So.
And people taking the deep well from the groundwater containing this concentration, and the gum completely black, and they don't have enough ditch. And
from the excess fluoride?
Yes, from the excess. And World Bank already provide about $15 million for cleaning this. But this happened what 20,000 no 2012.
2012.
Yeah, 2012. And under communist regime, you know, this funding is not going to treat.
They took the money and then used it for something.
Thank you.
Else. Yeah, yeah. So, but again, to my question. So, people here in Spokane think, well, I need fluoride. There's an easy way for them to get it without putting it in the water supply, right? And so. If somebody really has a concern and they think they need more fluoride, what can they do? They can.
There's nothing, because we already add chlorine into water to keep our drinking water safe and clean.
Right. That is a public safety health thing to kill the bacteria and whatnot. Yes. But when you put fluoride in, that is a medicine decision. Correct?
They add extra chemical, but unnecessary.
Right. So, but they can, if they really think they need it, they can go to their dentist and get a mouthwash with extra fluoride in it, right? And they don't have to force it on all the rest of their neighbors and everything.
So I hope for next November, people already knew what happened. Why is they need to add extra fluoride into drinking water? So you guys will make your own decision to vote no.
Well, thank you so much. And in your presentation, there were so many other questions I had for you. So I'm going to have to set up a Skype or Zoom call with you, and we'll keep following on this.
I'm happy to talk with you and keep in touch together.
Well, thank you very much. And I hope you enjoy your stay here and come back again when it's not so smoky. We have a forest fire going around here now, and maybe next time when you come back, it'll be clear blue skies.